Hi, Pansy. It is 27th of June, 2016. We're going to do some tests today. Tell me what's the number one concern or the number one issue for which you're seeking solution. What's number one?
The jaw pain.
Tell me about it. Whereabouts is it?
It's right here on the right side. It can go clear up to the eye.
Turn and show me.
Okay.
There you go.
It can go clear up to the eye and it just hits and it's excruciating.
Okay.
It just stops me from anything I'm doing.
Okay. How would you describe it? What kind of a pain? Dull pain, sharp pain?
Sharp. Intense. All the ones.
Okay. Well, sometimes people have like a electric shock kind of pain. Others it's more like a sharp, like a needle. How would you describe this?
Mine can vary. It can be the what did I say?
Electric shock?
Yes, like that. Or I call it twisting and ripping. It's just horrifying.
Is it always in the same?
Varies.
Is it always in the same place?
Yes.
Okay. And how many days a week do you have this?
It can be continuously. It can all of a sudden lessen a little bit, but it can keep me up at night.
Mm-hmm. On a scale of 1 to 10, using a pain scale, 10 is the worst. Mm-hmm. What's your average? Where are you most? Do you ever get to be no pain at all? 0?
No.
It's always something there.
Yes.
Okay. What would be the lowest level it ever gets? Like a
5.
Like a medium.
Mm-hmm.
That's the lowest it ever gets. What is the average? What's most of the time?
About 9 or 10.
You're kind of running around 9 or 10 most of the time?
Yes.
Okay. Does it ever, I think you mentioned last time, it goes up to 30.
Well, that's when I tell my friend 1,000, or it's just so bad that you feel it's just way out there.
Okay.
It's so bad.
I understand. All right. How often does that happen?
Pretty often.
In a week, about 7 day week.
I'd say at least 4 days, and it could vary. Talking when I go to talking, like even on the phone, I just almost have to stop. Sometimes I don't take phone calls.
You take care of kids,
Yes.
daycare, so you got to talk.
I know.
Okay.
I watch it as much as I can, and they'll catch me kind of tearing up sometimes. They'll ask if they can kiss it.
Oh.
Because they think that's what
Little
takes
kids.
the boo-boo away.
I see.
So-
Well, that's nice of them. So tell me when it started. How long ago?
About in 2014, about out in the middle of the year, August or September.
Okay, this is end of June. It's about 2 years.
Yes.
During this 2 year period, I know it came on suddenly. Has it been staying the same, getting better, getting worse?
It goes back and forth.
Okay.
It can be just that day, or it can be a week, 2 weeks. It just varies.
Okay.
But I'd say this year it's gotten more intense, where it's there almost all the time.
Okay. All right. So in general terms, it's a little bit worse than it was 2 years ago.
Yes.
All right. And I'm sure you have tried a lot. Tell me briefly what all you have tried.
Well, of course, went to the regular doctor, the MD.
What did they say?
They didn't know anything. I'm not a specialist I'm not a dentist.
So you went to a dentist?
Yeah, I've been to a dentist, and basically all they did, they've never diagnosed me with TMJ.
Okay.
Basically all they did was take x-rays.
Okay. The X-ray of your teeth?
Yes.
All right.
They've done the PNO, which is around the...
Right.
I'm sure you know that.
Got it.
But, and then the ENT is actually who told me maybe I'm grinding my teeth at night.
Right.
So I went back to the dentist, and they had that teeth, the thing you put in your
Bite
mouth.
guard?
Yes.
For nighttime
Had
use?
one of them put in.
Okay,
And
is that top or
actually
bottom?
they said you can use it anytime if you need it more, and I'm really using it a lot lately.
Is it helping a lot
Always
then?
at nighttime. It varies. Sometimes I think it's like you just lose your mind. You don't know if it's helping or not. When one of them horrible, intense pains comes on, I'll even take it out. It seems a little better, but then I need to put it back in. So it's just, you just almost...
So sometimes you have pain with that in the mouth and you took it off, it get
Yes.
better? So what would you put it back on then?
Sometimes then, if you're just as to keep it from coming, you think.
I see.
That's what I would think, hoping it won't.
Now I'm just
come.
thinking, like, if you have pain with it in the mouth and you take it off and the pain feels better,
Yes.
it seems to me like it's not helping a whole lot.
Right.
Okay.
And I don't know that the ENT just said maybe you're grinding your teeth at night.
Okay.
I guess there's really no way for them to know.
All right. So that is the main thing with the jaw pain. Anything else about the jaw pain? In what else? In what other way does it bother you? I think you mentioned it's always on your mind. You're worried about it.
Yes. It's talking because you want to talk. I am a talker. You can ask my husband, as he said, when he was here last time. I'm a talker. Even to go and kiss the kids or cradle them sometimes, it hits and you can't even open your mouth to give a kiss, or it's just there. So talking a lot with my husband at home, I can't even talk to him, but maybe that's probably a good thing.
No, not on purpose. Yeah.
Yeah. But and eating, I'm like, as you can see anyone else, I love to eat, and I can't do a cheeseburger now. Anything to open your mouth and bite into. Of course, I've had trouble, had to have a crown replaced because I sheared it off. Yeah. And that was from my teeth just falling together with a vengeance.
I see.
And he said he'd never seen one sheared off that bad.
Got it.
So they put it back in with a titanium post. They're not sure that will work. If it doesn't, they'll have to try something else.
I see. That's on the upper, right about the eye tooth area?
Right here on the,
okay. All right. What kind, you mentioned cheeseburger is obviously not this hardness, it's soft food.
Right.
It's the opening part that is off.
Yes, and opening so wide.
How about hard foods that don't require a lot of opening? Can you eat those?
I'm scared of them. And my chicken, I love chicken, but I just pull it off with the fork and eat my chicken, fried chicken.
I see.
But I'm scared. I eat way back on the left side because I want to miss the front tooth there. Mm-hmm. That's where I eat. But yesterday I had a fairly good day. I was actually able to eat on the right side, which is unheard of.
Okay.
M&Ms. I love peanut M&Ms, but I have to do regular.
Does that hurt?
I want a taste of it because the peanut, I'm scared of them.
I see.
Anything hard, I'm scared of.
Is it scare based on experience, where you bit into something that hurt, or are you just thinking it might?
It has made my mouth hurt, different hard things.
Okay, that's how you learn to be scared of it.
Right.
I understand.
Right.
Okay, that's number one. If the jaw pain is better, what's after that? What else do you have as an issue?
Well, like the knee.
Tell me about it.
Knee. Well, it's bone on bone, the orthopedic surgeon says.
Okay, and you
I want to get that taken care of because we tried going to Silver Dollar City. That was a fiasco. Mm-hmm. My husband and I and my son, he's very heavy, 350, and my husband has COPD, and I couldn't walk. Silver Dollar City, I don't know if you're familiar with it, up and down the hills. We barely went in, and we just had to turn around and come out.
I see. So you mentioned about left knee. Mm-hmm. You had surgery on the right knee before.
Yes, and it's doing great. I just had an appointment the other day. It's done wonderful.
How long ago did you have the surgery done?
June 22nd, a year ago.
Okay. All right.
So it's just doing great.
Okay. But the left knee there thing, you're going to need that also.
Yes.
All right. Any other issues? Those are the top two?
That's the top two that I can think of.
All right. And if you find a solution for those, especially jaw pain, you'll be happy.
Yes.
All right.
Yes.
Thank you.
What lies behind every smile is how your bite is aligned. 'Cause it shouldn't hurt to smile when your bite is aligned. You're feeling fine.
Hi, Pansy.
Hi.
Today is the 8th of August. It's been exactly 1 week since we placed that orthotic on your lower teeth. And I haven't put you on the computer yet, but I kind of wanted to get an update from you. What is the main reason you came to us?
The intense jaw pain
And where did you have it?
on the right.
Okay.
And it's just up and down toward the ear and then toward the eye
Okay. And how long was it going on?
since 2014.
More than 2 years?
Yes.
Okay. And what all had you done to try to get relief for it?
Went to doctors, dentists, which was supposed to be TMJ specialists, but I don't think they were. And to a nerve doctor, to an ENT, so just all kinds of different, right there in town. And
You're from Sedalia?
Yes.
Okay.
Nobody could help me.
Okay. Did anyone say anything about what they think is causing all this?
No.
Okay. You mentioned nerve doctor, I get neurologist.
Yeah. Now the ENT, he thought I was grinding my teeth, but it was just a guess.
Okay.
And they made that thing for me for my mouth.
The ENT doctor did, or dentist?
No, the dentist did.
Okay.
But it was his idea.
Got it. I see. We had a mouth guard.
Yes.
All right. Did that help?
Somewhat. I just really can't say. Sometimes it would, and sometimes it didn't do anything.
Okay. And then the nerve doctor, the neurologist, what did he have to say? What did he recommend
He
for you?
really didn't. He just kept giving me pills every time, and he just had no idea.
And
He was just kind of lost, I thought.
I see. He didn't say that. He didn't say he was.
Say it.
Okay.
I just felt it.
Okay. And how many times did you see him? How long did you see him?
It wasn't long after that upset with him claiming I was, I used all the drugs. I'd say a little over a month, if
Okay.
that.
Okay.
And every time I go, it was more pills, more pills.
Okay. So since in the last week, how did you feel when you first made the change?
Oh, very good. And no pain at all. And then it's just picked up, like I said, just that flash, just boom, boom. It'll do that. And it's never done that. I mean, it always lasted. It wasn't just like Sunday morning, I do Sunday school. And at first I could hardly talk. It hurt so bad. And then it just started lessening up and I was fine the rest of the day.
Okay.
No pain.
In the past, what were you like? Were you able to do the Sunday school before?
A lot of times I had to turn it over to him. I'd have times when it was just excruciating.
Okay. All right. Kenny, what all do you see from your perspective? What Pansy's going through? Any changes?
Oh, I see a lot of changes since she's up her last. She isn't shown to me that she's in any pain lately. I know one time she did say, she hollered out for something that caused a little pain. Was that what you did? Yeah.
Yeah. Well, we have just started like a week ago,
Yes.
after being going on for over 2 years. All right. And what is the second issue you had? Something about anxiety and sleeping. Tell me about those.
Well, the sleeping, I'd wake up in intense pain, and then from then on, the rest of the night, it's set up.
Before?
Because it seemed like if you laid down, that pressure laying down would really make it go crazy.
Could be. And how often would that happen? Every night or once in a while?
It got toward the end, it was every night.
Okay. When you say towards the end, how long? How many months?
I'd say a couple on that.
Okay. So every night, when you fell asleep, it'll wake you up with pain.
Wake me
Okay.
up. That's what would wake me up.
Okay. And so now in the last week, how are you doing?
Wonderful. I sleep all night long.
Oh.
No pain whatsoever. And you gave me all that information, and you talk about putting your lips together and your teeth apart, and that seems to, if I get the pain kicks in, that seems to really help. I guess it's relaxing. That helps.
So you're able to sleep and rest up?
Yes.
Because you take care of a bunch of kids
Oh,
during the
yeah.
day. All right. And the other thing has to anxiety. You mentioned you were a little anxious before. Any changes there?
Well, oh yes, I have hope now. Before I had no hope. Well, my dentist, and he's my dentist all the time, he basically told me the last time, just live with it.
Who's your dentist? I forgot the name.
Dr. Holloway.
Okay.
Jeffrey Holloway.
Okay.
And he basically told me I've just got to live with it. And that was like, to me, a death sentence. Because that's not what I want. I want it taken care of.
Yeah, and you had intense pain. You had like a little bit of pain
Yes.
before. Okay. And I remember that's what Kenny was saying. That bothered him that you're suffering so much. Any other things you noticed? Good or bad?
I can't think of anything right now.
Any changes in your knee problem at all?
No, it's still pretty much the same.
Okay. Okay. All right. All right. So it probably is, I'm guessing, a little hard to believe for you.
Well,
after
yeah,
suffering
after
for
so
2
long.
years, we
Right.
put something in the mouth that is making this much of a
Right.
difference. Okay. So that's kind of what I wanted to get your opinion, because I haven't even seen your mouth yet.
Right.
But I wanted to see how you're doing. Thank you. Pansy,
Hi.
today is the 12th of September, day after 9/11,
Yes.
2016. Today's our six weeks since we started phase 1 orthotic treatment on you. I wanted to kind of catch up and find out how you're doing. And tell me how you're doing overall.
Much better. I can eat now. I can sleep without waking up in pain. So I'm
That's-
excited about that.
That's a good thing. That's a good thing. The number one issue you had when we met was you had this shooting jaw pain. Tell me about it. Where would that be?
That'd be all up the right side of my face, just
Okay.
like an electric shock.
Okay,
And it's gone.
good. It's 100%
None of
gone.
that.
Excellent.
100% on that. 100%
Awesome.
gone.
And how much did it used to hit you before? How often would it? Every day?
Before I came to see you, it was constant. Every day. Every night it was going to wake me up.
Okay.
And I'd be setting up the rest of the night.
Would it happen during the day too?
Oh, just off and on.
Okay, nighttime for sure.
Yes.
So you won't get a good night's sleep.
No.
Okay. You also have some jaw pain and talking, brushing, and so on. You still have some of that.
I still have some of it.
How much of an improvement is that one?
I'd say it's improved to 85% or so.
Okay, that's good. So the other one you had was you're really anxious about this whole pain thing because you're worried about it hurting.
Right.
And also you told me that you pretty much didn't get much hope. Tell me about that.
Oh, I
You
have
went to a lot of
hope
doctors.
now.
No, you went to a lot of doctors before.
Yes, a lot of them.
Okay. And were you, am I correct in remembering you feeling kind of hopeless and anxious?
Yes. Because none of them would help me.
Did they even have an idea why you?
No, not at all.
All right. And I know you went to neurologists
Yes.
and you also went to a dentist who's supposed to be a TMJ specialist.
Yes.
Okay. All right. And so how much of the anxiety is gone?
I'd say 85% also on that.
The anxiety part. So you're not
Yes.
so tense and worried about it
Right.
anymore because you have some hope.
Right,
Good
definitely.
deal. Good deal. And then you mentioned about eating. Tell me about that.
Well, I can eat now without experiencing pain. I mean, I used to, it could take me, like I said, a hamburger just on a plate, no bun. Well, it could take me, of course I have to cut them all up, many pieces. And it could take me a half hour or more to get it eaten. So that's definitely improved.
Okay. Well, can you eat pretty well now?
Yes. I still cut them up because a big bite does bring on pain if I go to take a
To
real
really
bite.
big bite?
Yes.
Okay. How far can you open comfortably?
Pretty far now.
Okay, go ahead and
but
show
if
me.
you go to take a bite,
Okay. Well, that's open pretty much. That's pretty good. All right. You can open that much comfortably.
Yes.
All right. Anything else to add?
I can't think of anything.
So 6 weeks of, I'm kind of curious. Tell me how you felt before you came here. I'm guessing you're really skeptical because no one has given you hope.
Right.
So,
And so I felt hopeless.
sure. So if you were to know somebody that kind of how you were, what would you tell the person? Like, you're pretty hopeless. And what made you decide this makes sense?
That,
It-
well,
this-
once I met you and you started, working on me, and the things you told me, that gave me hope. You were saying something like you hoped you could help me, and you have.
Based on, we took a lot of measurements
Yes.
before I came up with that one.
Yes.
Good. Well, thank you. I'm glad you're doing better. It's only 6 weeks, and we've only done one arch, but you're doing good. I'm glad to know that. Thank you.
Thank you.
Today is the 10th of October, 2016. We're just finished the first phase, and we're planning on making a long-term device in a few minutes. Wanted to kind of quickly catch up with you. You came to us because of excruciating jaw pain. Tell me about that. How long did you have it?
Since 2014. And there would be times in there where it might stop or lessen, but then by the time I came to you, it was all the time.
It was constant.
Yes, keeping me up all night and
Yeah.
things like that.
And I think you told me at that time on a pain scale 1 to 10 was 30 or 40.
Yeah,
Pretty intense.
yes,
Yeah.
yes.
And where else would you feel it? Into the ears or eyes?
It would it's
you
like
point to me?
electric shock. It would go up up the jaw into the ear and even clear to the eye.
Okay. All right. So tell me about that. Do you have that anymore?
No, not at all.
And what percentage would you say on that one?
Well, I'd say 100%.
100% gone. Awesome.
Yes.
That's always good to hear. And anything else to do with the jaw pain?
Well, just like when I would talk, now that still can get me. I get stressed. In my job, it's very stressful.
You take care of kids.
Yes. But as far as the chewing and stuff, I still cut my food up, but usually I have no problem there. Before, just to open my mouth would be excruciating. And forget then, I put the food in my mouth, there's no way.
Yeah. Can you open your mouth now?
Yes.
Go ahead. Show me. Yeah. No problem with that?
No problem.
You couldn't do that before
No.
without hurting.
Yeah.
I see. Well, good. Good to know that. The other thing you also told us about was the anxiety about the pain. Tell me a little bit about that.
I don't feel that no more because I'm just real hopeful, very hopeful, and things have been changing. So
It's been going on for 3 months now, so you
Yes.
have a pretty good thing to rely on, I suppose.
Right,
Yeah.
right.
And so tell me about that. When would you feel anxious before?
Just knowing it was coming. Like I said, to talk to my people when they came in, I just pray, God, please let me be able to talk. So I'd be talking all right, but just in excruciating pain.
This would be like parents dropping off kids?
Yes. Mm-hmm.
I see. Good. And we also noticed your neck was just so tight as can be. Now it is pretty much normal.
Right.
Anything else you noticed, and anything else that you want us to know?
Well, like I said, I can sleep all night.
That's good.
That's very good. I'm enjoying that. And I can eat very well now without probably worse on the waistline, but so that's just some of the things, and I'm really excited and feeling good about that.
Perfect. Thank you so much.
Thank you. You're welcome.